Hi guys, my name is Jeff Puckett. I'm working with the group on eating disorders. I'm covering the portion of binge eating. So let's get started. What is binge eating? Well, according to the National Eating Disorder Association, binge eating disorder is a severe, life-threatening, and treatable eating disorder characterized by recurrent episodes of eating large quantities of food, a feeling of a loss of control during the binge, experiencing shame, distress, or guilt afterwards, and not regularly using unhealthy compensatory measures to counter the binge eating, such as vomiting, purging, stuff like that. This means that the individual typically engages in this type of behavior as a result of something else going on inside of them, which can be linked to things like depression, anxiety, past traumas, whether it be emotional, physical, sexual, whatever, or even underlying addiction problems that have gone unresolved. According to the Diagnostic Statistical Manual, binge eating diagnosis criteria consists of A. Recurrent episodes of binge eating. An episode of binge eating is characterized by both of the following: eating in a discrete period of time within any 2-hour period, an amount of food that is definitely larger than what most people would eat in a similar period of time under similar circumstances. 2, a sense of lack of control over eating during the episode, a feeling that one cannot stop eating or control what or how much one is eating. B, the binge eating episodes are associated with 3 or more of the following: eating much more rapidly than normal, eating until feeling uncomfortably full, eating large amounts of food when not feeling physically hungry, eating alone because of feeling embarrassed by how much one is eating, or even feeling disgusted with oneself, depressed, or very guilty afterwards. C, marked distress regarding binge eating is present. D, the binge eating occurs on average at least once a week for 3 months. And E, the binge eating is not associated with the recurrent use of inappropriate compensatory behavior, as in bulimia nervosa, and does not occur exclusively during the course of bulimia nervosa or anorexia nervosa. Some of the facts about binge eating disorder. Binge eating disorder has affected almost 3 million people in 2015, and that was just in the United States by itself. Binge eating disorder often starts in individuals at a very young age, in their late teens or early 20s. It is usually accompanied with overweight and obesity, but not always. It's most commonly seen in women, but does still affect men. And most of the suffering from binge eating disorder, like 97% of the total amount, go without any diagnosis or treatment, which means only 3% are actually seeking any kind of medical assistance in curbing this disorder. Most suffering from binge eating disorder do not compensate with diets, fasting, exercise, etc., which often results in the overweight body types. Risk factors of binge eating include family history, psychological issues, and poor diet management. Signs and symptoms of binge eating disorder. Binge eaters most often are overweight, but this is not always the case. They tend to eat larger quantities of food more often. They eat faster than normal. They oftentimes prefer to eat alone. And this is because of the shame and the guilt and whatnot. They show the emotions of guilt, shame, and disgust, and they don't want to be seen in that way. They tend to diet frequently, but don't show results of the dieting. And they tend to isolate themselves more than usual, or more than the typical person. Complications of the binge eating disorder, they can result in diminished quality of life, increased isolation, poor socialization with others, overweight and obesity. They can develop diabetes, heart disease, and even breathing issues. Sometimes I think also like an acid reflux tends to surface. And they also encounter depression and anxiety at a much higher level than previously before the disorder. And then sometimes it can overlap into other issues with disorders like substance abuse. They tend to purge on drugs as well, just the same as they did on food. So anyway, that's the gist of binge eating, and thank you for being present.